baby making is a big investment, requires a big investment. So what is currently the insurance cover for IVF?
Infertility is going up, so more and more women do opt for IVF, but sadly, none of the policies give any kind of meaningful cover.
Welcome to our Tracking Healthcare Insurance series. Today we are going to talk about pregnancy and whether your insurance policy covers all aspects of pregnancy and delivery costs, including IVF and neonatal care. What are the exclusions? What you didn't know existed between the lines? How much of out-of-pocket expenses you have to make? All these questions that you have in your minds will be answered today by our health correspondent, Anonna Dutt. Welcome, Anonna, to the show.
Hello, Rinku.
Hello. So, first of all, I decide to be pregnant today. Do I need to therefore think about my health insurance plan at least 2 years before, when I hadn't planned the baby, and see whether my future is insured or not?
Sometimes 4 years ago.
4 years ago. So,
Yes. So
let's hear from you.
Most health plans that are available in the market will have a waiting period for pregnancy, to cover pregnancy, which can be between, so in some cases, but very few and very expensive policies would give you a 9-month waiting period, but the average is around 2, and there are also policies that would make you wait for 4 years. So the waiting period is one thing that everybody should consider. And yes, you have to get it in your early 20s if you are planning to get pregnant by mid-20s.
That is something. People only thought one waited for egg freezing and other issues of pregnancy and work breaks. But, insurance is something that we need to plan ahead. That is number one takeaway. Number two is reading between the lines. We have a policy paper, and we need to know what each of the clauses mean and what they are not covering.
So waiting period is just the tip of the iceberg. I went through several of the most common policies, general insurance, health insurance policies that are available in the market. And if you look at the policy wordings, even with, say, the 5 lakh to 7 lakh coverage is what people usually get. And every policy had a maternity sublimit. And with these policies, the sublimit would be somewhere around 20,000 to 40,000, which does not cover any kind of maternity care if you are in cities like Delhi or Mumbai. So typically, if you go to a small nursing home, probably 40,000 would be enough for a delivery without complications. But if you're going to the big chain hospitals, you would be spending upwards of 1 lakh, and most of it would not be covered by your insurance.
So what is the average cost of a normal baby delivery in big centers? The average, if you
Right.
cities in India.
So, I mean, this would not be applicable to, say, tier 2, tier 3 towns. It would be slightly cheaper there. But if you're living in the metros, then you would be paying about a lakh and a half for C-section delivery at the big hospitals, the big chains.
Okay. So therefore the sublimits really do not work at big centers.
So the payment that comes out of insurance doesn't work at all. And in fact, when I was looking at the policies, there were 2 types of policies.
Yeah.
One was a policy which had an inbuilt maternity cover, which was hardly any. In the 4 policies in which I went into the details, the wordings of it, only one policy covered maternity inbuilt. The others offered some sort of additional add-on kind of thing, in which, again, you wouldn't end up getting more than, say, 20 to 40,000 of benefits, and in the extremely expensive ones, covers policy which covers, say, 50 lakhs to 1 crore. Those policies you would get probably a lakh of maternity coverage, but not the common ones that people usually purchase.
Okay. And the most obvious question, which a lot of our readers and viewers have asked us, is the position of insurance regarding IVF, because a lot of women are going in for IVF procedures. Sometimes these can go up to 8 to 10 cycles of procedure involved, and there is substantial out-of-pocket expense if it is not covered by insurance. So what is currently the insurance cover for IVF, for women seeking IVF procedures?
So you're right. Yes, infertility is going up. So more and more women do opt for IVF, but sadly, none of the policies give any kind of meaningful cover.
That's very important.
Yes.
No meaningful cover for those seeking IVF procedures. That's the second takeaway, I think.
So, in fact, the policies, hardly there were any policies which did say that we cover IVF, but even the ones that did, the upper limit was the limit for maternity care. So that's again, if it's 20 to 40,000, that's nothing for an IVF.
That's nothing for a person seeking IVF. What about birth complications? So far, we are talking about normal deliveries, but sometimes during the course of a pregnancy, a woman may report complications. So what are those complications, if you could list those complications, and how do existing insurance policies look at these complications?
So, of course, the most common complication with pregnancy is bleeding. And sometimes you need to have, like there's a rupture, so there's a need to stitch up in certain cases. But the policies do not cover maternity or its complications mostly. The ones that do cover, again, the limit is whatever is for the maternity package within the sublimit, within the policy. So again, it doesn't mean anything because when you have these sort of complications, you are likely to spend more days in the hospital, which will add to your bill. So, I mean, if it doesn't cover the basic thing, you won't get any sort of coverage for complications.
So, if I have a complication and so when I have a complication, does it cover, I mean, I'll have to pay extra for the period outside a normal pregnancy package, whatever a normal pregnancy package entails?
So, in fact, I would like to give a point here. Ectopic pregnancies, which is pregnancy that happens outside of your womb. So sometimes the egg gets fertilized and it gets stuck in the fallopian tube. Those sort of pregnancies can lead to a burst of fallopian tube. So these are complications that can get life-threatening. And most policies said that, it won't cover any maternity complications other than ectopic pregnancy. So that's one thing that is covered. But I mean, people do not need to pay additional. That depends on the kind of package that they have chosen. So most hospitals have like a pregnancy package which has, a
certain number of days fixed.
Yes. So you won't have to pay any additional amount for that. But again, most of it won't get covered by your insurance.
Okay, not quite a rosy picture there. So how much of insurance helps us? What about neonatal care? The baby is born, and what if the baby has complications, is in NICU? What is the post-delivery cover or protection that an insurance policy can offer or not offer?
So again, that is again a significant gap in the coverage of insurance policies. Most policies start covering the newborns at day 91. So till 90 days, they do not get any cover. They can be added only on day 91.
And that's 3 months.
That's 3 months. So most babies who are born with complications would need NICU care immediately. And NICU care can get very expensive very quickly. It can be, in bigger cities, it's around, say, 10,000 per day just for the bed charges. And then you have all the additional charges that come with being in a hospital. So you do not get that cover. There are, however, add-ons which say day one coverage. But again, the ones that do have that add-ons have a sublimit. So only, say, 25% of the policy amount can be utilized. Newborn care.
All in all, baby making is
An
a big,
expensive.
a big investment, requires a big investment. Also, my final question to you is, you spoke to a whole lot of policy companies on this. Is there a way that they are thinking of upgrading the packages or factoring in these complications, looking at IVF to make it more friendly to the user?
So the thing is, till even a few years ago, maternity was not covered at all because maternity is not a disease. So
Yes.
it was never covered under insurance policies, especially the older policies, which were mostly government-run companies. With the entry of these newer private companies into the insurance market, there has been, they saw the need in the market and they have made these, different add-ons and different policies for maternity, which they in fact advertise as maternity policies, but they failed to keep up with the prices of healthcare. So that is the sad reality, but I'm hopeful because earlier it was not covered, now it is covered. So I'm hopeful in the future there would be better coverage.
Anything that the health ministry is concerned about these policies, or the insurance regulatory authorities are concerned about the way these policies are currently contoured, have you, in your discussions with these officials, at either the health ministry or the insurance authorities, seen some kind of change in their approach to how pregnant women and expectant mothers can benefit from insurance?
So right now, I have not seen any particular discussion about maternity. Right now, I think the focus is to get more and more people covered under the insurance,
yes.
especially the elderly who need the coverage the most, but their policies are very, very expensive. So that is one of the focus areas of IRDAI, the regulatory authority. But no, I have not heard of this conversation as of now, but I might be wrong there.
And these insurance policies, finally, because a lot of women are choosing to have their babies late. So is there an age bar? Suppose somebody is choosing to have a baby in their 40s, biologically, for example, they can still have, there's a possibility there. Is that a factor in insurance policies?
So I did not see that in any of the policies. There's no age bar to being pregnant. They do cover the pregnancy after the waiting period. But the policies say that they will cover only if you've, in your lifetime, had just, like, this is your first or the second baby, not beyond that.
Okay. So there you go. Next time you plan a baby, you better plan your budget beforehand. On that note, we thank Anonna for joining us and sharing her insights on a very sensitive but important topic. For more on tracking insurance and healthcare spending, please stay tuned to theindianexpress.com, and we'll bring you more such insights in the future. Thank you.